India, there is a sudden explosion of vehicles. People want to buy their own vehicles, and there's no driver training, there's no driver proper licensing, and therefore you see that there is a total chaos on the roads.
We as the humanitarian agencies, we need to be looking at not only how we're doing our work to deliver humanitarian assistance, but we need to be operating our vehicle fleets in a way that actually improve road safety. We need to be in the forefront of being safe fleet operators.
We have a huge amount of non-motorized transport on our roads, and therefore you see that 80% of the people who die are vulnerable road users in our countries. And amongst them, the age group up to 35 has the maximum number of fatalities. Our children, our youth, we cannot lose them in road accidents.
Vehicles are an absolute essential. They're a means of us to do our work. We're operating vehicle fleets in this type of environment, and we, our staff, our own vehicles are at risk at all times. We cannot deliver our programs unless we can operate safely. There's a huge emphasis, an increasing emphasis on security, the security of field staff. But safety of field staff is equally important. A very large number of the security incidents that we face as humanitarian organizations are in fact vehicle related. We are on a daily basis in many developing countries facing enormous risk from just simply traveling on roads like we're looking at here today.
India has a record, a very, very bad record of road safety. We got perhaps the worst record of road safety in the world. So the imperative of India building in road safety concerns into everything we do is the highest priority of government, and we are now doing that. We can't remain at the bottom where road safety is concerned. We really are at the bottom.
I can give you numbers about our hospital and our center, and this is pretty alarming that in a span of about 24 hours we see more than 120 injured patients, out of which at least 20 to 30% are seriously injured patients, and this puts in an extreme pressure on our available resources in terms of our critical care units, in terms of our ventilators, in terms of our manpower. If you see around this ward of just 30 patients, you would see patients who have been amputated, who have lost their limbs. You would be seeing patients who've had serious brain injuries. We see these patients daily. We see families and lives being destroyed because of road traffic accidents. And I think people need to know about it. People need to be educated. Right now here in India, we're in more than 100,000 deaths and more than 400,000 seriously injured patients happen every year.
In 2004, World Health Day was dedicated to road traffic injury prevention. It was the very first time this happened, and it shook up a little bit the health community because it never had considered road traffic crashes as a real public health problem. And from there on, we have seen a movement of change in the health community, and it really doesn't make sense to invest in some aspects of health and then ignore others, which in a way cancel out the benefits from the initial investment on other issues. But we cannot do that without at the same time dealing with injuries, and more specifically road traffic injuries.
There is also very serious absence of coordination between education, enforcement and engineering. They must communicate, must share with each other, share good practices, share information, share challenges, ultimately to save human lives. Listen, I tell you, every time I'm driving on the road, I'm not sure that my vehicle, even if I'm driving safely, I won't get hit. It's like a daily war we fight every day, daily war to survive, daily war to live, daily war to come back home safe for our family, and for our family to come back safe for us. It's a daily war of survival.
In the course of my work in the humanitarian sector, I've worked with UN organizations, with the Red Cross and with NGOs, and it's extraordinary that there's such a low level of understanding of the implication of road safety on development, on the achievement of the Millennium Development Goals. And there was a mistake, I believe, that the road safety and traffic and transport was not mentioned in the MDGs. The MDGs cannot be achieved unless road safety and transport are integrated into those goals.
I think having worked with UNICEF and WHO, where the critical issues are how to save lives, how to ensure that people lead healthy lives, and how children can develop. I wish more people could recognize that preventing road accidents is very much both a health issue and a development issue. This is an epidemic already. The time has come to take very serious measures on this. Like we did for polio. You actually have to make a declaration and make a commitment, and then actually have plans, draw plans to say, what is it that needs to be done to make this happen? Like we have done. We've done it in other fields of development and health. And I think we have to recognize that this is as important and key an issue, like polio, like malaria, like some of the other issues that we've taken seriously. We have to take this seriously. Take action now, otherwise it will be too late.